Hello everyone. Today we begin an important topic in microbiology, sterilization and disinfection, essential practices to prevent infection transmission in healthcare. Instruments and equipment can contact patients directly or indirectly. Contaminated items are a common route for healthcare-associated infections. So how do we prevent transmission from contaminated items? Sterilization and disinfection are the core strategies used to make items safe for patient care. This video will define key terms, compare methods, explain item risk classification, outline reprocessing steps, and finish with a short summary checklist. Before we begin, remember this key point. Cleaning is always the first step before disinfection or sterilization. Sterilization is the complete destruction or removal of all forms of microbial life, including bacterial spores, rendering an item sterile for critical use. Disinfection eliminates most pathogenic microorganisms on surfaces or instruments, but does not reliably destroy bacterial spores. Cleaning is the physical removal of visible soil and organic material using water, detergents, and mechanical action. Decontamination is any process that makes an object safe to handle, reducing contamination to a level that permits further processing or disposal. Remember the hierarchy: cleaning first, then disinfection or sterilization depending on the item and its intended use. For example, visible blood or soil must be removed before any disinfectant or sterilization method can be effective. Methods for rendering items safe fall into two broad groups: physical processes and chemical processes. Both are chosen based on item compatibility and risk. Steam sterilization in an autoclave uses high-pressure saturated steam to achieve sterilization and is widely used for heat-stable instruments. Dry heat and gas methods such as ethylene oxide sterilization are alternatives for heat or moisture-sensitive items, each with specific cycle parameters. Disinfection is described in levels. High-level disinfection destroys most organisms except high levels of spores, intermediate and low levels target fewer organisms. Common chemical disinfectants include alcohols, chlorine compounds, and hydrogen peroxide. Each has advantages and contact time requirements. Always follow manufacturer instructions and validated protocols when selecting a sterilization or disinfection method for any medical device. Items are classified by infection risk using the Spaulding framework. Critical, semi-critical, and non-critical categories determine required processing. Critical items enter sterile tissue or the vascular system and must be sterile. Examples include surgical instruments and implants. Semi-critical items contact mucous membranes or non-intact skin and require high-level disinfection or sterilization, like endoscopes. Non-critical items contact intact skin only, such as blood pressure cuffs, and typically need low-level disinfection between patients. A standard reprocessing workflow includes cleaning, inspection, packaging, sterilization or disinfection, and proper storage until use. Monitoring and documentation are essential. Use chemical and biological indicators, maintain logs, and verify cycles meet validation criteria. Always wear appropriate personal protective equipment during cleaning and reprocessing to protect staff from exposure to contaminants and chemicals. Common mistakes include skipping thorough cleaning, using incorrect disinfectant concentration, and improper packaging before sterilization. Store sterilized items in a clean, dry area and handle packs carefully to maintain sterility until point of use. Quick checklist: clean thoroughly, inspect for damage, choose validated method, monitor cycles, document results, and store properly. Follow facility protocols and manufacturer instructions. When in doubt, treat items as higher risk and choose the more protective processing method. Thank you for watching. Proper cleaning, disinfection, and sterilization protect patients and staff. Review your facility procedures regularly and stay safe. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging, step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.